Hi everyone, it's me, I'm back. I know it's been a while, over a month since my last video, but I needed some time. I got such amazing news from the doctor with the full pathological complete response, so PCR is what it's called. It was very overwhelming, exciting, but at the same time there was still a lot going on. I wasn't done treatment, not done treatment, I'm still currently in treatment with radiation, and I just needed some time to decompress, process everything, and just kind of like settle. It was a very big shift in mindset for me, knowing that I got the PCR, and it was hard to deal with, even though it was amazing news. So anyways, I've taken some time. I'm back now. Check out the hair. Holy crap, I have a full head of hair. Still very short, but it's covering my scalp now, so I don't see my scalp, which was a big goal for me, a big landmark to hit. So yeah, this is the do for now. It's probably going to take quite a while to grow the top out enough to actually be able to cut a style into it. But for now, I just do what it lets me do to it in the morning, because it's kind of has a mind of its own. Yeah, so I thought I'd do a quick update on what's been going on. Obviously, as I mentioned, I've started radiation treatment, so I'm going to get into talking about what that process was like, what I had to do to prepare for it, and what it's like going through it. But first, I thought I'd talk about some of the stuff that I am doing to help my body recover. I have mentioned a number of times in my previous videos about the neuropathy that I have in my hands and my feet. That's still happening. I have actually talked to my doctor though. Last time I was so overwhelmed by the good news that I completely forgot to talk to her about my hands and feet. But I ended up calling because I was trying to ride it out and see if it would just like get better once I hit like the 3-month mark after chemo, but it wasn't getting better. So I called her and we had a discussion about it, and I am currently on some medication. It doesn't like take it away, but it sort of takes the edge off of it. Which has been helpful in just getting me a little bit more active, going out for walks, just actually feeling better. Because when you're in pain, or you're constantly aware of something like throbbing or tingling on your body, it puts you in a negative mind frame for the day. So being able to just have, like, forget about my feet, for the most part has been helpful. In addition to that, I have started doing acupuncture. So I'm getting acupuncture done in my feet and my legs because I still have a bit of weakness in my legs, and then obviously the neuropathy in my feet and my hands. The only caveat is that since I had lymph nodes removed from my right side, I'm not allowed to get needles, blood pressure, anything on my right arm, as that could flare up lymphedema. So we don't do any acupuncture in my right arm, but we do some in my left arm, my legs, and my feet. So that was an interesting experience the first time, is getting needles put in between my toes. And at one point she actually put them on like the pad of my foot, which was just like, whoa! But it's all with the goal of helping to restore blood flow to my feet, which will hopefully help, flare up those nerves and rebuild them, and eventually I will no longer need medication. I will just have normal feet and hands. So just a little side note about my feet as well. As well as the neuropathy, I am losing one of my toenails. I knew that this was a side effect of Taxotere, but I thought maybe I had skipped that one because it didn't seem to be happening, but in the last month or so, my left big toe, the nail has been dislodging. So I'm going to lose that nail, and that creeps me out that that's happening. I tried putting like tea tree oil throughout chemo on my toenails to try and save them. But unfortunately, the one toenail is abandoning ship. So that's why my nails look really weird. With the acupuncture photo. But yeah, fun facts of cancer treatment. I'm also doing a special type of massage therapy. You might notice this here, this tape on my chest here. I'm seeing a massage therapist who specializes in lymphatic drainage and breast tissue. So she works with a lot of people who have had surgery on their breasts, breast cancer survivors who've had mastectomies, lymph nodes removed, and in addition to like just getting an amazing massage, she also works on redirecting lymphatic fluid that may have a difficult time, since I have lymph nodes removed, draining, thus the risk of lymphedema. She works on redirecting that fluid to fully functional areas for that drainage. So she does massage for that, as well as this tape right now is somehow helping redirect the fluid to the right side. She's also helping with trying to create a text message. In addition to trying to redirect the lymphatic fluid to a more fully functional area of the lymphatic system, she works on the breast tissue in order to try and help prevent scar tissue, just overall create like a healthy muscle tissue area where surgery happened, as well as where I didn't have surgery, just, balance kind of thing. And the goal is that this is going to, like I said, help reduce scar tissue, which will help with hopefully reconstruction and just a healthier breast area. So enjoying that. So in addition to the massage therapy, the acupuncture, I'm also doing therapy, which is a huge thing. And in my book, it's a necessary thing following everything that happened this year. So I actually started the therapy prior to surgery. At that time there was definitely a lot of fear. There's a lot of grief around the surgery and losing my breast, as well. For those who have watched my videos from the start, you know that at the beginning of the year, I was pregnant, and that was like a big deal. We had been doing IVF, and I lost the pregnancy in the same week that I found out I had cancer. So I didn't actually have the opportunity to like fully focus on the grief of that pregnancy loss, and it all became about, cancer and cancer treatment and what's coming next and stuff. Not to say I didn't grieve, because my God, there was a lot of tears, there was a lot of upset, but it was kind of like tainted by, like I said, all of the cancer stuff. So I feel like I didn't get to do that justice, but at the same time, so much time has passed that, I kind of fell into a place of like moving past it. Anyways, therapy, huge help and a necessity for me, and I would definitely recommend it for people who are going through cancer treatments, who have finished cancer treatments, and just need help like processing all of that grief, because it is grief. Like it's anger, it's grief, it's sadness, it's happy moments, it's it's fury. So it's a lot to process. So I'm gonna keep up with that. And like as a bonus, the medication I'm on for my neuropathy apparently is also an anti-anxiety medication, so I'm kind of getting a twofer there. Anyways, so that's kind of what I've been up to with regards to what I've been trying to do to help my body heal, and both mind and physical. In addition, I've been trying to just like do more things. Like we've gone out to the movies a number of times. We've seen some friends. I'm just, saying yes instead of no kind of thing, or just trying to get out more. And that has been very helpful for my mood and my energy, because oddly I've had like so much energy, and again, I don't know if that's a medication, a positive side effect of the medication I'm taking, or if I just truly have a bit more energy now that I'm approaching 4 months out of chemo, which is crazy to think because that's just as long as I was on chemo. But yeah, I'm gonna ride with it and take it because yay, that's fun. So anyways, let's talk about radiation treatments. The final step for me in my cancer, I hate the word cancer journey, but my cancer journey in 2021 is culminating with radiation treatments. I am getting 15, which I think is the lower side of how many treatments you can get, but or be prescribed. But I'm not arguing with that, and that's cool. I'm thinking maybe because I got the PCR, this is, they're going with a more minimal approach to how many treatments I'm getting. Radiation for me is, and well, for everyone who takes it after, is kind of like it's more of a preventative step in that, there was no sign of cancer in my breast tissue, in the lymph nodes they removed when we did surgery. Hopefully what it is chemo did its job. It wiped out all of the cancer that we knew about, and hopefully at the same time also wiped out any cancer cells that might have been floating around my body, because I did have lymph node involvement, so that means like theoretically the cancer could have escaped from the breast area and started floating around my body, trying to set up shop somewhere else, like my brain, my lungs, my liver, my whatever. The hope is that chemo took care of all of that, and the hope is that if there's any residual cancer cells hanging out, that the radiation is going to take care of that. So that is why we're doing radiation. I get that question a lot about like, well, aren't you cancer free now? Like, why are you doing radiation? Right now, we don't have the science that says, how effective, if getting radiation treatments now is going to help me have a less percentage of reoccurrence versus not doing radiation at all. Maybe in 10 years, 15 years, they'll have the science that they can say like, hey, actually it doesn't make a huge difference, so let's skip the radiation. But I'm living in 2021 and with the science of 2021. So radiation so far has been fairly simple. I started off with a CT mapping appointment, which is basically they put me in a CT machine and scanned the area, and were able to identify all of the target spots. And in doing that, they're doing a bunch of measurements so that they can line up your body perfectly every single time in order to direct the radiation to those specific spots every single time. And the way that they make it so that you can line your body up perfectly on all 15 occasions, in my case, is they give you little tattoos. So I now am tatted up with 5 tats. They're little tiny dots. So if you watch Friends, maybe you'll get the reference of it. It's the planet Earth, but from like really far in space looking down. So I've got 5 of those. I've got one on my stomach, one on my sternum. That's my sternum. Correct me if I'm wrong. One over here, and then one each on the sides. So the mapping appointment didn't take long. I was in maybe half an hour or so for them to get all that going, and then I was set for radiation. So every day I go in, because radiation happens every weekday. Every day I go in, and they line me up, and then this big machine kind of circles around me, gets to the points, and then it's like, and that's like the radiation going. All in all, for me, it takes less than 5 minutes for them to complete the cycle of where they're directing the radiation. So it's super fast. I'm in and out usually in less than half an hour every day. And so far, I'm not feeling anything. Like, I'm not feeling any of the side effects, really, with the exception of, on occasion, and I don't know if this is still like surgery leftover feelings or if this is radiation irritating the area and this is why I'm feeling it, but like my scar area here just feels like I've got a slight sunburn on it. I'm not red, I'm not pink even yet, but it feels like I have a little bit of a burn. So what they recommend is this moisturizer, which I apply multiple times a day, like 3 or 4 times a day to that area. And then they also go through my shoulder area, so I moisturize up to there. So this is the moisturizer that my hospital recommended. They were very clear that this is the one I had to get. My friend actually who went through radiation a few months ago had recommended a couple other products which I had purchased in advance, but my hospital was like, no, you want to use this stuff. So I'm sure I'll find use for this later, and you know, maybe a little bit after radiation is finished, but you know, I'll find a use for it. But this is the stuff that I don't know if I can get it in focus, but this is the stuff that they recommend. And a cool tip that they gave me was when it's feeling hot and burning is to put this in the fridge so that when you apply the cream, it's nice and cool. So what I did is I bought 2 of these, and one is in the fridge and one is in the bathroom. So I can choose, depending on how I'm feeling, whether I want a chilled cream or if I just want a room temperature cream. So yeah, like I said, right now I'm not having any of the side effects, but that's not surprising because they did say that you don't actually start to feel the side effects of radiation until like 2 weeks in or so, and then the fatigue starts to kick in, and you know, I can start going pink or red. Worst case is, you know, I can get burnt and my skin can start you know, opening up and stuff like that. But I'm only getting 15 treatments. I don't think it's going to get there. I'm hoping I'm going to have minimal discomfort, and that you know, at the worst it just feels a little bit of a sunburn. They also say that like 2 weeks after you finish treatments is kind of where everything peaks, and then you start to feel better. So I'm looking at, you know, November, hopefully it'll peak end of November, and then like December, I have no treatments. I am done with cancer treatments. I can just focus on trying to get my body healed and healthy again, as well as my mind. And it's my birthday, so I can celebrate my birthday. It's Christmas. Hopefully it won't be another secluded COVID Christmas, and I'll actually get to see some of my family, within reason, obviously. But, you know, I'm hopeful for a good December that is just about kind of healing, and then I'm looking at going back to work in January, hopefully. So, exciting times. Yeah, that's what I have been up to, and what the last month is. I know it's a lot, and this might be a little bit of a longer video, we'll see, but I just wanted to bring you up to date on how things have been going, show you my wicked awesome hair, and show you that I'm doing okay. I'm doing well. I even put some makeup on today for this video, so I feel special. Alright, so that's about it. That's where I'm at, and maybe in my next video I will address like how radiation went, because I will be done in 2 weeks, and just what the future holds, what I'm thinking of, and what I'm hoping to see happen in 2021. No, 2022. It's currently 2021. 2022. That's the year. Good things are happening. I've been doing wellness stuff, so like gratitude meditations and stuff like that. I don't know if you can tell, but just trying to focus the mind in positivity, and keep the negativity and the fear at bay. So anyways, I hope everyone is doing well, enjoying their days, and I will see you in the next video. Thank you for watching, and thank you for subscribing and liking the videos. It means a lot to me. I will see you next time.